Spirometry is effort dependent. The patient must understand the testing needs as you have explained them and be cooperative during the actual testing process. Furthermore, 10 to 15% greater volume can be achieved with good coaching. So, in order to ensure reliable spirometric results, it is imperative that you, the technologist, have positive interaction with the patient. Whenever possible, the spirometry should be performed with the patient sitting upright and straight, with both feet on the floor. This is especially important as patients may become lightheaded and unable to stand during testing. Tight clothing should be loosened so as to reduce any restrictions it may have on the patient's ability to breathe deeply. Testing may be performed using two different methods, the closed-circuit method and the open-circuit method. First, we will look briefly at the open-circuit testing method. The patient breathes in as deeply as possible to total lung capacity, then inserts the mouthpiece between his or her teeth, making sure to maintain a lip seal. Finally, the patient blows out as fast and hard as possible, completely to residual volume. Before introducing the closed-circuit method of spirometry testing, let's look at two key terms, residual volume and total lung capacity. Residual volume, commonly referred to as simply RV, is defined as being the volume of air remaining in the lungs after maximum expiration. Or more simply put, residual volume is the amount of air left in the patient's lungs after having blown out as hard and fast as he or she can, until it seems that the lungs are empty. Total lung capacity, or TLC, is the volume of air in the lungs at maximal inspiration, or the amount of air in the patient's lungs when he or she has breathed in as much air as possible. Now we're ready to discuss the closed-circuit method of spirometry, which is typically easier for the patient to perform than the open-circuit method, so it tends to produce the most reliable test results. We'll focus on this method, closed-circuit, for the remainder of the unit. First, we'll do an overview of the process, then go through it again, this time in greater detail. The patient positions the mouthpiece in his or her mouth, then breathes normally through the mouthpiece. Finally, the patient breathes in as deeply as possible to total lung capacity, then blows out as fast and hard as possible, completely to residual volume. Now, let's go through the entire testing process using the closed-circuit method. You've already introduced yourself to the patient, recorded the pertinent information about the patient, and verified the physician's order and reason for testing. The next step is to thoroughly explain the procedure to the patient. The patient should be instructed on the importance of good posture during the testing. Demonstrate proper posture for the testing position the patient will use, seated, looking forward, and with both feet on the floor. Instruct the patient on the proper placement of the mouthpiece in the mouth. The mouthpiece should be placed in the mouth with the patient's tongue under the mouthpiece and the lips tight around it. While the mouthpiece should be firmly clasped and the lips sealed tightly around it, the patient should not bite the mouthpiece. If the patient has dentures, ask him or her to remove the dentures and place them in a container. Explain to the patient that you will place nose clips on his or her nose prior to the test to force all breathing through the mouthpiece. Then go over each step of the actual test with the patient. 1. Place the mouthpiece in your mouth. 2. Breathe in and out nice and easy. 3. Breathe in as deep as possible, but do not hold your breath. 4. Blow out hard and fast. 5. Keep squeezing all the air out for about 6 seconds or until I tell you to breathe in deeply again. 6. Take the mouthpiece out of your mouth and relax. One key to successful test performance instruction is to always demonstrate the procedure with animation and the same level of effort expected of the patient. Remember, with proper instruction, coaching, coaxing, and motivation, almost every patient can achieve an acceptable peak flow. Spirometry is effort dependent, so good interaction between the technologist and patient is necessary to ensure accurate test results. The patient must understand the testing process and be cooperative. Testing should be performed sitting, looking forward, and with both feet on the floor. The closed circuit method is the easiest for the patient to perform, so it generally provides the most accurate results.